Listen to this combo. You can sail away and get a Botox boost or a filler plump while on vacation. But is that a good idea to get a little pick-me-up while on a cruise ship? What do you think, Dr. Doherty? A little vacation tweak?
So this is an interesting scenario and actually not all that uncommon. I don't think it's a good idea. I think doing injectables and filler procedures are important to do with a physician, and I appreciate a board-certified plastic surgeon that knows what they're doing and can follow up with the patient.
So this is medical tourism except in transit. And patients, how can they be on a cruise? How can they think it's a good idea to get an injection which involves needles, could be bruising, there could be complications, and wouldn't that ruin their vacation if they can't go in the sun because they have the bruise? If they have a complication, do they have facilities there to take care of things? So by and large, I agree. I don't think it's a great idea.
Yeah, I think a cruise lends itself to a spa-like scenario, so a facial, a massage, something like that. And actually, I've had several patients that have come to me after these experiences. So specifically, I had a lovely woman in her 60s who had come from a cruise and spent what sounds like a long period of time in the spa. And she ended up coming, she had a list of a whole aesthetic plan that was marked out for her, including injectables, etc. And she ended up having a laser procedure, which was a non-ablative laser resurfacing procedure, an excellent procedure for her and for her face, but clearly not something to be done at the time when she's going to be exposed to sun, and also something that needed to be done multiple times. And so she spent money and did something and really didn't get a significant response from it, and I really think was sort of sold something that wasn't necessary.
I think you make a really good point in that so many of the aesthetic services that we have that are non-surgical, the injections, the lasers, broad-based light therapy, all of those devices are things that require a treatment plan, and a treatment plan occurs over time. And when a patient engages in a treatment plan, it's all about developing a relationship with their practitioner. And these are not things that can be done in isolation, like on a cruise for a week.
And they're not something you can pick off a menu and say, I'm ordering and buying Botox or filler, because it's such an individual thing, and that's how we take care of our patients, is individually.
Exactly.
Take a vacation from the cosmetic procedures while on vacation.
Absolutely.
That's
you can read about it while you're on there.
That's your advice, okay. For the very latest, check out theplasticsurgerychannel.com.